Welcome back to Breakfast. It's contributed to the deaths of 2,235 New Zealanders so far. Now, our response to the COVID pandemic is to be investigated by a Royal Commission of Inquiry. The review, costing $15 million, is being widely welcomed and will be looking at evidence early next year. Joining me now are two of the people who've been advocating for the inquiry: Otago University epidemiologist Professor Michael Baker, alongside New Zealand Initiative Chairman Roger Partridge. Morning to you two. Thank you so much for being with us. Roger, we'll start with you. How crucial is this Royal Commission of Inquiry in your mind?
It's critical. We closed our border to 1 million Kiwis overseas for more than 2 years. We shut down our biggest city cumulatively for more than 6 months. We had one of the strictest lockdowns in the world. Part of the reason for that was that our health system wasn't as resilient as it perhaps might have been. We had the fewest ICU beds in the OECD per capita. So there are lessons for us to learn, both about our preparedness for the pandemic and our the way we conducted our policy during the pandemic. So it's critical. Having said that, I've got a few concerns about the way the Royal Commission's been set up, but I'm sure there'll be an opportunity to talk about those.
Absolutely, we will. Professor Baker, I wanted to get your response as well, because you've been at the coalface of our national response, and we're so grateful for all of the insights that you've provided, especially on this show. What do you want to see come out of this inquiry?
Well, Morena, Matty. Look, I think the terms of reference are really appropriate. They're focused on what we can learn and how we can do it better in the future. Because unfortunately, the frequency of these global pandemics and emergencies has increased. I mean, we've had 7 declared public health emergencies since SARS in 2003. So we really do need to learn from this so we're better prepared for the future.
The successes and the failures, right, Professor Baker?
Yeah, and I think the terms of reference make it very clear that nothing will really be off limits in terms of looking at things that could have been done better. So I think that's really appropriate.
Roger, it's a vulnerable position to put the government for the government to put itself in, I guess, especially a government that's had its fair share of criticisms over the past few years during our COVID response.
Yes, but the terms of reference have been quite narrowly drawn up, and there's an unusual choice of chair for the Royal Commission. I'm quite in favour of the balance between an economist, a politician, and an epidemiologist. But Professor Blakely's by no means the independent chair you might have expected for a Royal Commission like this. He's been a regular media commentator in New Zealand. He's sought to influence the country's pandemic response. He's even occasionally written in conjunction with my co-commentator, Professor Baker. He's also very closely associated with the state of Victoria's pandemic response. So if we were looking to compare the overall impact on well-being in New Zealand with, say, Sweden's, then Professor Blakely already has a clearly articulated preference. So we're not getting the kind of independence that you might expect in a Royal Commission like this.
Professor Baker, do you have a response to that? Because you do know Professor Blakely and you work alongside him. What do you make of that?
Yeah, look, I think Tony is obviously a public health doctor. He is focused on looking at the outcome, particularly with a public health lens, but in many ways that's appropriate. He also has a strong interest in health economics, so I think he's got a broad views. He does use economic assessment tools, very standard ones. In some ways, it may be very hard to find anyone who has a totally neutral view on the pandemic, since it's affected so many of us, or all of us, in very dramatic ways. So, yeah, I think that's a fair comment to make. But I think actually Tony, in his work, is very focused on the use of evidence, and he certainly will bring a vast amount of, I think, very good experience and skills for this role.
You think the parameters are fair and reasonable, but there are some concerns about the limited parameters by which this Royal Commission of Inquiry will take place. And the questions, I guess, that pose the most concern are the fact that it's kind of looking more at the how rather than the why. Are you concerned by that?
Well, I think that's not quite right. I mean, the why is issues about did it produce good outcomes from a health point of view, an equity point of view, and an economic point of view. So they're all very big why questions. So I don't think, in fact, I think in some ways, some of the issues around how, which is descending into a lot of the details about whether particular decisions were right or wrong at the time, would be a concern, because I think they've got limited time, 18 months, to do this review. And it means that in fact you do need to have a very high level or high level questions, which I think is what the terms of reference are focused on.
Roger, you mentioned the terms of reference and your concern about the narrow scope in which you see it. What are your main concerns there?
Well, there are three things really. Public health response requires a weighing of costs and benefits. For example, the benefit of stopping the spread of the pandemic by closing schools has to be weighed up against the costs to well-being from the lost schooling and from lost social interaction. Yet nowhere in the terms of reference has the Commission expressly asked whether we got the balance right. Instead, the focus is very much on our elimination and later minimisation and protection strategies and whether they were effective in limiting the spread of the virus. But that's only half the equation. It's also troubling that nowhere in the terms of reference is there any reference to the decision to shut New Zealand's border and to ration spaces for Kiwis wanting to return home. If there's any aspect that the team of 5 million might want to question, it's whether we dealt with the million Kiwis overseas fairly. Yet in the terms of reference, they don't even get a mention.
Michael, Professor Baker, what would your advice be? And what would you want to see a main focus on to make sure that we do get this right in the future?
Well, I think one of the areas that particularly mentions is really around the infrastructure we need to manage these events, including particularly the decision-making system, and that's going to be vital. And looking across responses in different countries, this choice of strategy was absolutely fundamental. And I guess one of my biases would be I think the evidence is very strongly in favour of applying an elimination approach early on in a pandemic. The countries that did that have come through with much better outcomes, I think, including economic outcomes. So I think there's a lot of evidence to support that, but obviously this is a chance for the commissioners to step back and say how robust is the evidence for the strategic choice New Zealand made at different points, compared with other countries. So hopefully, and I think it will come out because it is really fundamental to get that right.
Thank you so much for both of you for joining us this morning. That's Professor Michael Baker from Otago University and Roger Partridge from the New Zealand Initiative. We really appreciate your insight this morning, and we'll look forward to following this Royal Commission of Inquiry as well. Thank you so much, both of you, for being with us.
Thank you.
Right, stay with us. Up next.